Joseph Alpert again with the American Journal of Medicine. I'm here to call your attention to what I think is a very, very interesting article in this month's AJM. It comes from Spain, Garcia Vega et al. And again, it's retrospective. So, this needs to be confirmed in a larger prospective trial, which I'm sure is perhaps underway already. The two sort of red line hot drugs these days are the sodium glucose transporter inhibitors that block the reabsorption of glucose in the urine so that you're spilling out glucose, and it makes diabetic control much better. But what was interesting was in a number of diabetic trials, suddenly they noticed, oh, not only does it, control the diabetes better, but heart attacks were down and strokes were down. So then they ended up testing it in people who didn't have diabetes, and the same thing was there. It was marked improvement. It turns out it's not just a spilling of the glucose. It's a whole bunch of metabolic things that go on with this drug, and also with the new GLP-1 drugs. That is, the now become street drugs for weight loss. Wegovy and Ozempic are their brand names. And the question is, since both of these drugs are beneficial both to diabetics and non-diabetics in terms of cardiovascular disease, what happens if you combine them? Do you get even more benefit if you combine them? Well, of course, they're very expensive, but in Europe, where the costs are not so high, retrospectively, in a number of databases, the people in Spain were able to pull out patients who were on either the GLPs, or the glucose blockers, and individually and together. And it turned out that combining them actually resulted in greater benefit than either one of them alone. So, I mean, right now in the United States, they're very expensive, and it's often a battle with the insurance companies. But I can see in the future, once these drugs become more readily available, we will have many patients high risk for coronary artery disease. Many diabetics with complications are going to be going on the combination of these two drugs. The glucose blockers are oral, where in their name is the word flozin, like dapagliflozin, and so I always call them the flozins. It's easier to say it that way. But the GLP-1s have to be injected, but they're both exciting new drugs, and stay tuned, because there's going to be a lot more studies with them and a lot more interesting information. Stay tuned, follow us in social media, and I'll be back to talk with you again next month.